Hi everyone, welcome back to Know Your Body series. Today's topic is about high blood pressure, as known as hypertension. Okay, so I want you first to visualize your heart as a motor, okay? And then from that motor, you can see the incoming pipe. That pipe will carry blood from the body to the heart or to the motor, that called vein, okay? And there is outgoing pipe that carry blood from the heart to the body, and that called artery. Okay? That motor has a switch on and off or dimmer. Okay. So, when the heart is in the dimmer is in the on situation, the heart is gonna squeeze, okay? And that blood, and there's a forceful blood going out of this artery. Okay, the blood that's gonna go out when the heart is in the squeeze situation, it's gonna be under high pressure, putting too much pressure on the wall. Okay, that's what it's called, beat timing, and that's what it's called in medicine as systole. Okay, on the other hand, when that dimmer, it's in the off situation, it means that the motor is in a relaxed way or relaxed time. That's the time between beats, okay? And when the pressure inside those arteries, it's gonna be less, okay? This will lead us to have two types of pressure from the heart function. One, the pressure of the squeeze time, and one of the pressure of the relaxed time. Okay, those two numbers are the numbers of the blood pressure that everyone knows. For example, the 120/80. The top number, it's the blood pressure in the artery, okay, during the on or the squeeze status of the heart, while the bottom number, it's the pressure also inside the artery but during the relaxed status of the heart, okay, or between beats. Those blood pressure numbers are divided into three categories, okay? Normal, for example, when the blood pressure around 120/80, there is elevated when the blood pressure is between anything between 121 to 129 over more than 80, and there is high, this is elevated, and then the high when it's more than 130 and or more than 180, and the bottom more than 80. Okay, now that's another topic about why do we need to lower blood pressure, and what's the blood pressure, and what's the best way to reduce the blood pressure. Okay, that motor with this outgoing pipe and the incoming pipe, like a normal motor, the whole idea is to have less pressure going out of the motor, because this will make it live longer. And if you have less blood, it means less pressure, and will make you like healthier, and you can maintain that motor for longer period of time. The most important thing I wanted to remind you that blood going from that pipe is gonna go to the whole body, while the incoming blood is gonna carry blood from the body. Okay, now One modalities to make that pressure low is if you have a smaller body. Okay, smaller body, it means less demand, so this artery doesn't need to be thick and wide. It can be smaller to carry enough blood to your body if your body is smaller. Okay, the other concept is if that blood inside this artery is thick by anything that will make the blood thicker, can create more pressure. So have extra fat, sugar, salt. Salt also can absorb water. All those things can make the pipe wider and bigger. So when we want people to control their blood pressure, those are very simple or startup way by weight loss. Try to make sure that they stick with low fat diet, low sugar diet, and low salt diet. Okay, and then after that, if the body continue or if the blood pressure continue to be high, we would go to medicine. It's very important for you guys to be adherent to prescribed medication. This is crucial. Do not stop taking any medication without consulting your primary care doctor or cardiologist. And if the blood pressure, remember, if the blood pressure is well controlled, it's because of medication and not because it's secured. I also want to remind you that untreated high blood pressure may be silent but can lead to risk of stroke, heart attack, kidney disease, and other disease. So I will have the next video. I will talk specifically about medications of blood pressure. Before we conclude, I wanted to remind you that this channel aims to enrich your knowledge and simplify complex subjects. Those topics discussed are general and it's not tailored to your personal health needs. Always consult your primary care or specialist for personal health issues. And for emergency, please call 911 and seek immediate help. If you find this video helpful, please like, share, and subscribe to stay updated with more content from Know Your Body series. Thank you very much and have a wonderful day.